There's a lot of talk about customizing cancer care, being able to move forward with cancer care to the most modern capabilities of our entire system. Well, I'm all about natural treatment. I think natural treatment's great. Good diet, low sugar, lots of water, good exercise, all those things are important. And I don't ever want them to be minimized. But in cancer care, sometimes you need all hands on deck, and you need medication, and you need cytotoxic drugs. Well, the latest issue of the JAMA, the Journal of the American Medical Association, April 18th, was talking about this drug and that drug and this drug, basically real strong cytotoxic drugs with a drug called Avastin, which limits blood vessel growth to a tumor. And that's great. It really can help. But what they said was that in all of the patients with lung cancer, this specific kind of lung cancer, that these two drugs with this blood vessel drug, that it just doesn't make sense. It doesn't work often enough for it to make sense. Well, the reason that they say that is because they haven't tested the individual for whether or not that drug will work. In our practice, we provide a test that looks at all the different DNA, the genetics of each cancer, to find out if this drug combination makes sense and if it will work. If it doesn't make sense and it won't work, why spend the money? It doesn't make sense. But if you're the one with the lung cancer, or someone you love has the lung cancer, and it'll improve their survival by 10 or 15%, that's a lot. So I think it's silly for us to have this big, I don't know, maybe it'll work, maybe it won't work on all the cancers just like that. I'm concerned about you. Will it work for you? Get the test. Some people call it a Greek test, or chemosensitivity testing, or a TU profile, whatever. Talk to your doctor about it. If your oncologist doesn't know about it, look it up and bring it to him. And tell him that you want to look at all the possible tests and all the possible treatments that will work for you. This Journal of the American Medical Association says, for everybody, it doesn't make sense, but for you it might. Get with your doctor. We're better together.